Okay, so this is a Chapter 19 homework assignment question, which is number 1.14, and it was requested that I go through this. So let's go ahead and just read it. The patient is a 48-year-old woman who was diagnosed with an aggressive form of breast carcinoma in the past year and had a radical mastectomy followed by chemotherapy. She also developed secondary myelofibrosis with therapy-related low-grade myelodysplastic syndrome, presumably due to the antineoplastic chemotherapy she's received. On occasion, the patient called her physician, reporting excruciating lower back pain that had developed rapidly over the past 2 days and was told to go to the emergency room. It was feared the patient had a compression fracture or similar condition due to metastatic bone cancer. The patient was admitted and examined by her attending physician, oncologist, consulting orthopedic surgeon. X-rays of the spine, bone scan, and CT scans of her lumbar spine failed to find any pathology, including no metastatic disease, much to the relief of the family, patient, and physicians. The physicians could not explain the rapid onset of the low back pain, which was treated with pain medication. On day 3, the patient reported less back pain and better ambulation and was allowed to go home with her family. Chemotherapy will be performed on schedule in the next 2 weeks. The patient continued to receive treatment for myelofibrosis and myelodysplastic syndrome. All right, so we've read through it once. Now we need to just start dissecting it. So, patient is a 48-year-old woman who was diagnosed with aggressive form of breast carcinoma in the past year and had a radical mastectomy followed by chemotherapy. So we have breast cancer. We have radical mastectomy. We have chemotherapy. Okay. She also developed secondary myelofibrosis. So she's got secondary myelofibrosis with therapy-related low-grade myelodysplastic syndrome. So that is therapy-related low-grade myelodysplastic syndrome. Presumably due to the chemo. So we're going to say due to chemo. On occasion, she's called and reported excruciating back pain that had developed rapidly over the past 2 days and was told to go to the emergency room. So she has what? Low back pain. It was feared she had a compression fracture or metastatic bone cancer. Now remember, we're not necessarily going to code all of these, but we are just going to put down everything that's possible and then we'll start the process of elimination, right? Patient was admitted and examined by her attending physician, oncologist, consulting orthopedic surgeon. We have x-rays. So we have spinal x-ray. We have a bone scan. We have CT scans of spine. Okay. Which failed to find any pathology, including no metastatic disease. So that means that right off the bat, we can say that there's no metastatic bone cancer, right? And what other pathology do we have there so far? Well, we have the compression fracture. If it says there's no pathology, it didn't find a compression fracture. So we can get rid of that, okay? So we've already eliminated 2 things, right? Okay. The physicians could not explain the rapid onset of the low back pain. So there's, what do we call it when they can't explain it? Idiopathic, right? Okay. But they treated it with pain medication. And we're just going to say down here, we'll say pain medication. They don't tell us what kind, but it's pain medication. On day 3, she reported less pain, better ambulation, and she went home. Chemotherapy will be performed on schedule. So we know her chemotherapy is a current thing, but not given in the hospital. Okay. And she is to continue to receive treatment for the myelofibrosis and the myelodysplastic syndrome. So this is what we have to work with, right? We've got this right here. So let's take a peek. So we've got breast cancer, but we don't know what kind. They don't say. They just say aggressive. She's had a radical mastectomy. She is having chemotherapy. She's currently doing the chemo, but she's not having any during her stay. She has secondary myelofibrosis and therapy-related low-grade myelodysplastic syndrome due to chemotherapy. We have low back pain, and then we have some things down here. Now, the big question is, why was she admitted to the hospital? What was her treatment directed at after study? Why was she actually there? The low back pain, right? She was in because of the low back pain. Everything was directed at the low back pain. They didn't treat the myelofibrosis. They didn't do the myelodysplastic syndrome treatment. They didn't do anything. They just gave her the medications or whatnot, but they didn't, everything was directed at the low back pain. So let's go ahead. Let me see if I can pull this up real quick. And we're going to just go ahead and delete all of these. We'll just do this. Huh, that would be a lot smarter, wouldn't it? Okay, so she's 58. And let's go ahead and pull up our, we don't want this one. We're going to put this down here. Okay, so now we should be able to work here. Okay, so we want the ICD-9 summary, right? Okay, so the first thing we're going to do is we've decided that our principal diagnosis is the low back pain. So let's go ahead and add that. So we're going to say pain, right? And we're going to go to pain. And where is her pain? In her back. And what here fits? Well, we don't know what it's due to. They say that specifically, right? And we do have a not specified above, but really that's not the best answer because we know it's low back pain. So let's go ahead and code that. Now, was there a procedure done? Well, they did do a CT scan, which, you know, here's the thing. The answer that you're given, it does, in these particular scenarios, they do have you coding the CT scan. We don't normally, I'm not going to mark you off for that in this instance. So we'll just go ahead and move through with no procedure, or you can pick CT scan, whichever one you'd like to do. Let's go ahead and pick CT scan since that is going to be there for a an answer for you. Well, if it's low back pain, it's obviously not cervical, that's your neck. It's not thoracic, that's your chest area, so it's lumbar spine, right? All right, do we have any other procedures here that we need to code? No. So we're going to say no, okay? Now, let's go ahead and mark off our low back pain here. All right? And we're going to mark off our CT scan. And we can also, related to that low back pain is the pain medication. So let's go ahead and cross that off too, okay? So, do we have anything else pain-wise that we need to code? No, we don't. All right, so far we have our lumbago or our low back pain and our CT scan. Now, we need to add some more diagnoses here, right? Okay, so she has breast cancer, yes, okay. So let's try cancer, okay. And we do know the site, don't we? But we don't know the type. So we're going to say cancer malignancy unspecified because they don't specify it, do they? But we do know the primary site, right? Now, it says here we have primary site of malignancy and we have some things to choose from. We have present or resected during this admission, which did not happen. We have present but site unknown, right? We have, but it's not present, and we do know the site. Previously removed, still under active treatment, and previously removed or treated, no recurrence. Now, here's the interesting thing. We're going to pick number 3. Why are we going to pick number 3? Because she did have it removed, but she is still under treatment with chemotherapy. So we're going to pick number 3, okay? And then we're going to choose breast. We don't know where on the breast, so we're just going to say unspecified. Now, do we have any procedures during this particular admission? We don't. Now, yes, she is getting chemotherapy. We're not giving her any during this admission. It doesn't say in there that we did. Also, it does say mastectomy here, but she had that at another time. That was a previous mastectomy. We didn't do it this admission. So remember, we have to think about what's going on with this admission. So let's go ahead and pick no procedure already coded. There are no metastatic sites. We already determined that with the bone scan, right? So there are no metastatic sites. We don't need to deal with status post-estrogen receptor. They didn't talk anything about estrogen receptors. And what does that give us? That gives us 174.9 malignant neoplasm of unspecified site of the female breast, which is what we have going on. Chances are it's gone, but because she's still under treatment, we don't code it as a personal history. Once she's done with treatment, then it can be a personal history, okay? So let's see what we've got here so far. Let's go ahead and take off this morphology code since we don't deal with those. So now what can we get rid of over here? Well, we can get rid of the breast cancer because we've coded that, right? We're not giving her any chemotherapy, so we can go ahead and pull that, right? Okay. Now what do we need to do? Well, we do have a radical mastectomy that she's had in the past. And how would we look for that? Is that something that might be important? Possibly, because of the fact that she's got that breast cancer diagnosis. So what would we code that as? Well, what are we going to say? We're going to say absence, right? Okay. So we have absent organ or part, okay? Extremity, fetal heart tones, organ. Why don't we say, spell it? So we have absence of a breast. And here's where we have to pick how it happened. And we know it was acquired because we did it to her. We removed it. So it's an acquired absence of the breast and nipple, okay, because it was a radical mastectomy. So let's say continue, all right? That means we can now get rid of the radical mastectomy here, right? Now what do we have left? Well, now we have left secondary myelofibrosis and therapy-related low-grade myelodysplastic syndrome due to chemo. All right, so when we say something is secondary, what does that mean? Think about it. It means that we have it because of some other reason. All right, so let's just type in myelofibrosis. Okay, there you go. Comes right up with secondary, doesn't it? So let's pick it and see what happens. Associated underlying disorder, malignant neoplasm of the breast, or other underlying condition not listed as above. Well, let's go back and read that real quick. And what does it say? She has also developed secondary myelofibrosis. So that's telling me that because of all of this, she's got that myelofibrosis because of the breast cancer. But we don't know where or why, so we're going to say unspecified. Okay? The procedure, we don't need to code that. It's going to take us right back through the procedure for the breast neoplasms. Let's see what happens if we do this. Let's just see what happens. Do you wish to code associated therapy-related myelodysplastic syndrome? Well, look at this. Therapy-related low-grade myelodysplastic syndrome due to chemo. Yes, we do, don't we? And what does it give us? It gives us different choices, and low-grade is one of them. Is it due to an anti-neoplastic agent? Yes, it is. It's due to the chemo, so we're going to say yes. Is it due to an antibiotic agent? Other or unspecified, because they don't mention anything about antibiotics, right? So what does that give us? That gives us, we have the malignant neoplasm, right? We have the myelofibrosis. We have the myelodysplastic syndrome lesions, and we have the E code for the anti-neoplastic immunosuppressive drug-causing adverse effects and therapeutic use. Because we're using it correctly, they're just having they're just getting that adverse, they've developed that adverse effect, right? So let's go ahead and click continue and see what happens. Well, now we have what? We have 2 of the breast. And this is something you have to be really careful of when you're using your encoder, right? So let's go ahead and remove one of those breast cancer codes, all right? Now, let's go ahead and get rid of these 2 morphology codes, all right? Now, what we're left with so far is we've got our myelofibrosis, so let's go ahead and get rid of that. We've got our low-grade myelodysplastic syndrome. Let's go ahead and get rid of that. All right, now, we also have left over here spinal x-rays and a bone scan. Now, we're not going to code the x-rays at all, but bone scan, it is in your answer. We're going to go ahead and code it because that answer is there. Just like the CT, we wouldn't typically code it as an inpatient, but these particular scenarios do have it. So let's go ahead and add that procedure. So let's just say scan. And we don't know what kind, right? We just don't know. We're going to spell the site, bone. Bone scan imaging. That gives us 9214. Okay. Now, let's look at, we got everything coded now? We've got our bone scan coded. Yeah. Okay. So now let's look at these things. Do you remember we talked about the best way to put things in order so that when they do print out on the bill, in case you run out of room, that you get all the most important information on that bill? Well, what we have up here is we have a V code way up here stuck in the middle, don't we? So let's just drag that V code down here. So now we have all of our number codes, and then we have our V code, then we have our E code. Perfect. Let's look at our procedures. So with our procedures, which of these is going to be the most involved? Well, obviously a CT scan is not a big deal. A bone scan is a much bigger deal. You're laying there for quite a while, and they're more involved. So let's go ahead and pop that one up to our principle. All right? And that right there, ladies and gentlemen, is your answer. That's how you get it. Now, this one is not included in the answers, and I don't agree with it. It needs to be, in my opinion. But if you didn't have it, I wouldn't mark you down this time. Okay? But just something to keep in mind. All right? Hope that helped.